Samantha Gardner, and I'm with Advancing States, and I'm joined here with Louise Rush and Dennis McGowan from the New Jersey Department of Human Services Division of Aging Services. In the spring of 2019, Advancing States and NCOA hosted an Innovations and Benefits Outreach national contest to identify promising practices and benefits outreach to persons with disabilities and older adults. We invited organizations to share about practices that provide outreach, education, screening, and assistance for benefit programs such as the Medicare low-income subsidies, SNAP, and LIHEAP. We were really happy with the variety of submissions that we received, and we selected 2 impressive awardees for the contest. Our first place awardee is the New Jersey Department of Human Services Division of Aging Services, and they were selected for NJSave. Dennis and Louise have joined me so that we can learn more about their practice. So thank you both very much for joining me so that we can talk more about NJSave. I would like to start by asking if you can share a little bit more about the New Jersey Division of Aging Services.
Well, the division for aging services houses many programs for seniors and disabled people. We offer federal and state benefits. We administer the AAA administration. We also look at Medicare savings programs, pharmaceutical assistance program, utility programs. Our office also do some Medicaid for MLTSS programs, such as our clinical assessments for MLTSS eligibility. We also work with the Adult Protection Services as well as the Office of Public Guardian. So we have an array of different benefits and services that we offer in New Jersey for seniors. So I would say that our office is the place to call if you're looking for information, for help, for assistance. And between our office and our AAA office in all of our counties, I think we kind of serve our seniors well.
Great. Can you tell us more about NJSave and who this practice targets?
So New Jersey Save, as we want to call it, NJSave, basically is an outreach program and an application process that we in the division looked at and said, how can we basically announce that these programs are there, available, and make it easy and accessible for our seniors and disabled population to apply for. So the application really combines 7 different programs into that one application process. And we think that, as technology has become available, we needed to kind of use it. Our application for New Jersey Save is basically online, so you can fill it out and submit it. But we also have a paper application for those who do not wish to use, technology. We wanted to target basically anyone that needed our help, and so the New Jersey Save campaign was started.
What was the primary reason that you decided to undertake this practice and implement it?
Well, in 2015, our Medicaid division basically started sending our division, Aging, list of names of people who were being terminated from the Affordable Care Act because they were turning 65 or becoming eligible for Social Security disability. And so every month we got about 8 to 1,000 names, and we figured, how do we reach out to these people? And we started with the paper applications and letters, and we did not get a good response back. And so we said, we have to do something better. Just sending a letter was not, getting the response we needed. So we said we needed some advertising, we needed some outreach, we needed some education, and we needed an easier way for them to apply for those benefits. So I think that's kind of where we started, and our eligibility rules were decreasing. And so this was a way to kind of have a win-win for our consumers and also for the program, because the New Jersey Save application actually offers a lot of benefits and a lot of savings that can be put back into our senior pockets. So I think our campaign and the process in which they can apply for it works for everyone.
Great. Can you describe any opportunities that facilitated the implementation of NJSave? So, for example, any new funding opportunities or any new policy directions?
Well, with the new administration, our Governor Murphy, one of his executive orders was to promote any programs that would help New Jersey seniors or any New Jerseyan. And so that was the I guess the catalyst for making us really move towards, let's get out and put the word out that we are there and there are benefits and programs and services that people would be eligible for. And we partnered with our Division of Medical Assistance and Health Services, also known as Medicaid. They were already building a platform for online application. And so we, as I would say, piggybacked on their process and their solution to build our program and our online application. So it made it easier. We didn't have to spend as much money as we were starting from scratch, but it still was very costly. So I'm the director for the division, so therefore I started looking at our budgets and seeing where I could find money and kind of put it all together, and voila, we have an online application.
So you touched on this question a little bit, but what resources were necessary for the implementation of New Jersey Save, whether it be financial, human, or technological?
All of the above. All of the above. What we had to do was, once we found the finances, we had to hire developers to come in and develop it. And then we needed licenses. And we also needed internal staff to help, talk to the developers to make sure that what we wanted was being designed. We also needed staff to go out and promote the online application. So Dennis and his team, they created a very robust campaign of internal staff, department staff. We also went to our AAA partners, and we also asked them to help sell, and they did. We offered them, we had to get them to buy into it also. So we offered them a portal, which as they would enter the information electronically into a system, they would also have a record of any client that walked into their county office, and they would follow that application through to completion.
Okay. So what were some obstacles that you all experienced while implementing this practice, and then as a result, any lessons that were learned?
A few different obstacles, I guess. One was we wanted to get out and talk to as many seniors as we could. So we did mailings. First we had to get the applications out, both the paper apps, and we had designed posters and flyers and little table stands and other things to promote NJSave, and we need those out in the community, otherwise people wouldn't find us. We didn't have a budget for television advertisements or bus ads. We had a small budget for advertising. So we did mailings to the pharmacies, to our main partners, which are the AAAs and the SHIPs, the Senior Health Insurance Assistance Programs, to Social Security offices and all over the place. So we had to get the applications out first. And when we did our mailing to senior centers and to senior housing buildings, we asked them, can we come out and speak with you? And we did get a lot of responses. So we have about 130 either scheduled or that we've already done. But there are many, many more places where we need to actually reach seniors and talk to them. So we need to do the next level of that. So we're going to run the addresses of senior housing buildings versus folks we already know are enrolled. So if we find a building that has 80 rooms, but only 4 people are in our programs, then we're going to talk to those buildings and say, you didn't invite us to come, but we'd really love to come because your people need this benefit. So that was one of the obstacles that we ran into.
Okay. And what outcomes have you all seen since implementing NJSave, and how are you measuring success?
We're measuring success based on the number of applications that we get in. And then hopefully those applications will turn into folks who are actually getting the benefit. So far, we've had about 9 months of the campaign, and we're up about 5,000 applications over the same period the year before. So we're doing very well, and about 4,000 of those are online. So it really is a brand new way for people to find us and to search for us. And we have about 35% of the applications that are coming in are being done by either social workers at the county boards and offices on aging, or by caregivers and family members. And that's kind of what we thought. You know, today's generation of seniors, yes, a lot of them are using the computers, but a lot of them are not. So we wanted it out there so their caregivers could find it in the middle of the night when they're worried and, you know, mom needs help paying for prescriptions or getting, you know, some financial break from her Medicare costs, that was a way they could find it.
So is there anything else that you all would like to share with our audience about NJSave?
I think the main thing, if you want to promote a program, is you don't necessarily have to spend a lot of money. A lot of money can get you far, and we are thinking, we had done some Facebook ads actually before we launched NJSave, and we did get a lot of response from that. So we're thinking about doing that again, and of course that is advertising, so that will be some cost. But you don't necessarily have to if you dedicate the staff and your partners and list your partners to go out and help promote what you're trying to promote. You can get some pretty good responses. And of course the product has to be good too. So who doesn't want to save a lot of money on Medicare and home energy costs and prescriptions? So.
Great. Well, I want to thank you both so much again for speaking with me and with our audience about NJSave. For more information about our benefits, education, and outreach initiative at Advancing States, please visit our website at advancingstates.org/MIPA. And thank you to all of our viewers for tuning in to this special interview with the New Jersey Department of Human Services Division of Aging Services.